Hello everybody, thanks for coming along to our webinar today, which is about exploring work experience for healthcare courses. Just a few kind of housekeeping bits and pieces. So you aren't able to use your mics on this call, but you can keep it, and we can't see you, but you can kind of get in touch with us via, it should be called a chat or questions button, where you can type stuff into us throughout the event, and only Georgia's staff and people on the panelists, the Georgia's people on the call can see it. So don't worry about that. So we really encourage you to submit your questions throughout, get in touch. Also, just to let you know that we are recording this session as well, and we'll be able to send that recording out to you after the event. So don't worry about taking notes or anything like that throughout. So my name's Fiona, and I work in the widening participation team at St George's, and I'm going to be kind of I guess running, taking part in this event tonight. We have got other people here as well. So my colleague Danielle is looking after the chat and questions, so she'll probably be answering any of your questions that you have coming through. And we also have a medical student, Isabel, taking part on the call today as well. Cool. Okay, so to kick off, I'd like to find out a little bit about you guys to begin with. So it would be really useful for us to know what course you're interested in. So obviously this webinar is all about work experience for healthcare courses, but it'd be really great just to get a sense of, the audience makeup, what you're all interested in, just so, we can be aware as we're delivering the session. So what I would ask, if you could please pop in the chat or questions pane that you should have there, just write the course that you're interested in. If you're a graduate and you're interested in a course, it would be really good to know that as well. So for instance, if you're interested in graduate entry medicine, if you could just put that in, and then I can see that. So I'll just give you all a couple of minutes to do that, and then I'll just have a look and see what kind of things everyone's interested in. Ooh, keep them coming in so I can see lots of you interested in medicine, some people in nursing, paramedic science, midwifery, occupational therapy, graduate entry, radiography. Amazing. So a bit of a mix. Cardiac surgery, so that would be medicine degree, yeah. Cardiac physiology, great. Amazing. Fab, thank you so much. It's just really good to just get a sense of, you, the audience, because we don't really get to interact with you so much during these type of events. Amazing. Paramedic science, medicine, healthcare, fantastic. So some of the courses we don't offer at St George's, so things like midwifery, dentistry, but hopefully I think that a lot of the content will be relevant to you anyway. Lots of you I can see are interested in medicine, which is great. Lots of you are interested in other courses like cardiac physiology, pharmacology. So clinical pharmacology is a course we offer at George's, which is a science course, but relevant work experience could be useful for that program as well. Amazing. Thank you so much for participating. It's really good to get a sense of what you're interested in. Amazing. So if we move on a bit, just going to talk a bit about what we're going to be going through and what we're going to be covering during the event today. So we're going to be talking a little bit about St George's, who we are, if you haven't heard of us. Then thinking a bit about what do universities mean when they say work experience for healthcare courses. And then we're going to talk a little bit about gaining work experience during a pandemic, what you can do. And obviously it's not, hopefully we're coming out of the pandemic now, but obviously we appreciate that opportunities might still be difficult to find. So just having a little think about that. And we're then going to look at why universities ask for work experience. And then we're going to think about reflection, why that's important in terms of work experience. And then hopefully we'll have some time for questions at the end. So what I would say is that if you do have any questions as we go throughout, do type them in, then you'll be able to answer. Maybe we'll be able to discuss them at the end as well. And if you have any questions for our medical student, Isabel, as well, do pop them in and just make it clear when you typed it there for our student. Fantastic. Let's move on. So just a little bit about St George's, if you aren't aware of us so much. So we are a specialist healthcare university, and we're pretty unique in that we share a site with a hospital. So currently St George's is based in Tooting in southwest London. You can see a nice picture there of our entrance. St George's Hospital started life in central London. There's pictures in black and white on the left you can see in the olden days, and St George's has been teaching people to become doctors since 1752, so a really long time. These days, the university has a specific healthcare focus that includes teaching medicine, allied healthcare courses, and also a couple of science courses, so biomedical science and clinical pharmacology. You can see from the slides there, so although we have a really kind of unique perspective, and our students have a very kind of unique experience because we share a site with St George's Hospital, we do have everything that a usual university has to offer as well. So you can see there, we've got a library, we have you know, a bar, we have lots of student societies and a really active SU as well. If you haven't heard of St George's Hospital, by the way, well, hopefully you have, because it's on 24 hours in A&E, and I know lots of people watch that. It's a really, it's a trauma specialist teaching hospital in Southwest London. So just to give that context. Yes, that's a bit about St George's and what we are and what we do. If you do want to find out a bit more about us, we'll send you links afterwards, but you can just go on and have a look at our website and find out a bit more about us. Okay. So I'm going to launch a poll in a minute, which again, hopefully you guys can get involved in. Let us know what you think. So in terms of yourselves and, you know, your perspective, so do you think at the moment that you have relevant work experience, thinking about the healthcare careers you want to go into? I'm going to launch a poll here, and hopefully it will pop up on your screen and you will be able to answer this. So do you think you've got relevant work experience at the moment? Your options are yes, no, or not sure. Maybe you're not sure, it's absolutely fine. It'd just be really helpful to get your perspective. If you're having difficulties answering the poll or clicking into it, if you minimize your screen, that can sometimes help. Again, just really useful to get, you know, find out a bit more about you, the audience, and where you're at the moment. So if you can participate in that poll, let us know where you're at the moment. That'd be really helpful. I'll just give you a couple of seconds to kind of fill that in, then I'll share the results with everyone. So you can see that nearly 80% of you have voted, which is great. Just leave it a little bit longer just to make sure everyone's had a chance to respond. Okay, nearly 90% of you have voted. I might just wait to get up to that 90% point before we move on. Maybe we're not going to reach there. We've got 85%. That's good enough. Amazing. Fab. I will close that poll now and I'll share the responses so you can see what the answers are. Okay, so basically 30% of you think you have got relevant, which is great. Relevant experience. 37% of you are not sure, and 33% say no. Okay, so pretty evenly spread, fairly evenly. Third of you kind of filling in each section there. So that's great. So hopefully this webinar will have something for all of you. So we are going to be focusing on reflection at the end of it. So that's really about making the most of your work experience. Those of you who aren't sure or think you haven't got any experience, hopefully, fingers crossed, you'll get kind of maybe a broader perspective of what might be relevant, and you might already have something, but we'll kind of see as we go along. But again, thanks so much for taking part in that. It's really useful to get a sense, like I say, of where you, the audience, are at. Okay, so I'm going to hide those results. Hopefully we'll be able to go back to the main screen and you can see the PowerPoint. Amazing, thank you guys. Okay, so moving on. Thinking a bit about work experience and what universities mean. Now, I would caveat this by saying that, you know, every university will kind of have its different perspective, so it's always worth just going onto the university websites or speaking to the universities and courses that you're interested in to get an idea of their particular requirements. So is it, you know, work experience something that your university and course are going to say you have to have? Is it something that's beneficial? And what's that particular university saying exactly? Because it will differ from uni to uni. What I would say, I know a lot of you are interested in a course in medicine, for example, and I would say that, you know, relevant work experience isn't necessarily about shadowing, and a lot of people think it is something where you have to get experience shadowing a doctor, and that's really hard to get. You know, obviously it's been really hard to get in the last couple of years, but even then it's really tricky to get that experience, and actually it's not something that most universities will require, particularly for medicine. Again, always best to check with the individual universities concerned, but generally I would say lots of universities and courses, healthcare courses, are going to be looking for students with work experience that involves working with people in need of care, and actually that can come in lots of different formats, and some of them are listed here. So it could be, you know, working in a care environment, that could be volunteering in a hospice or a care home. If you've got family and friends who are vulnerable, have health issues, then you might have gained some experience working with them. Community work is also can be useful. So things like helping out in soup kitchens, working with vulnerable sections of the community. That could involve, you know, disabled people, young children, very old people, homeless people, helping out in a food bank potentially. I would say that if you're working in an area where you're working with vulnerable people or people in need of care, then I would say you're probably going to have some relevant work experience there for healthcare courses. Teaching, doing anything with small children that's similar to teaching can be useful. If you tutor students, if you mentor younger kids at school, that can be relevant. Things like having a part-time job and working in sports societies can also be relevant. Now, they might not seem like that to you because they're not working with people in need of care, but actually, in terms of the skills that you can learn taking part in those experiences, they can be valuable too, and we're going to come back to that later on. Okay, so I'm going to just answer a few kind of, I guess, frequently asked questions that we have. We often get about work experience. So lots of people kind of ask, you know, well, we've already talked about what work experience can include. In terms of, you know, how much work experience you need, again, it can differ between universities. Some universities, like St. George's, we don't kind of have set rules on, you know, people need to have this much work experience or this many hours. Other universities might. I suspect there's not that many of them that will ask for it for, you know, undergraduate courses, you know, that aren't open to I think for graduate courses, it might be a bit different when people maybe have a bit more life experience. But again, lots of universities won't have those type of, you know, very structured requirements. And again, kind of, you know, what type of work experience or what counts? What counts is something that we get a lot at George's, and certainly for our courses, it's not really something that it's more, I would say, down to the individual, the applicant, to think about, well, what do you think is relevant? What are you going to tell us about? We don't, for example, when we're interviewing for medicine, we don't have like a tick box of yes, this type of thing counts and this type of thing doesn't. It's about the candidate making those links and talking about experiences that they feel are relevant and showing us that there are those links between what they've done and the skills and experience required for medicine. But we're going to come on to talk about that later. Another question we get quite often is, you know, does it have to be very recent relevant experience to count? And again, I think most universities would say that the more recent the better, but if you've done something that had a big impact on you, that was, you know, really important, and it was a bit longer ago, then, you know, it might be worth talking about. But I think it really depends on the individual, what experiences they have, what do they think is most important as to what to focus on most in an application to a healthcare course. Okay, cool. So we're going to move on a little bit from this, and we're going to talk a bit about COVID. So we know that it's been really hard for people to get work experience over the last couple of years. And on screen here, I put St. George's admissions entry guidelines. So these have pretty much been in place, I think, since 2020 onwards, and you know, they're still in place for 2023. Applicants applying for 2023. So this is a statement that we have on our website that applies to all courses that usually require work experience. So, you know, we're relaxing our work experience requirements essentially because we understand it's been really hard for people to get that kind of experience, particularly things like, you know, shadowing, volunteering in a care home or hospice, working with, clinically vulnerable people potentially over the past couple of years. But although we have relaxed our requirements, we still do require applicants to have an understanding of the realities of working as a healthcare professional on one hand, and also to show they've got the necessary skills and attributes for their chosen career. Okay. So what I really want to emphasize is that, you know, it's possible to get these things in other places besides clinical work experience, okay? And in terms of skills and attributes, again, that can come back to other experiences you've had that aren't in a kind of healthcare setting and making the most of them, okay? The link at the bottom is just something that we have on our website, which really has lots of kind of, I guess, resources for people that want to gain insight into different healthcare fields. So it's about, looking at online courses, podcasts, things like that. Things that basic resources that allow you to get an insight into the field that you want to work in the future. And that is partly what work experience is about. I'm going to come on to that again in a bit. Okay. So what I would say is that other universities may have kind of gone down a similar path. They might have relaxed their work experience, but some might not have. So again, just that caveat about checking with different universities about what they're asking for in their entry requirements and if they can give you any further guidance. Okay. So now we've had that discussion around, what types of things might be relevant. And something that I generally like to do with people asking about work experience is to just encourage that kind of looking outside the box a bit, thinking about what you already have and thinking, well, is it relevant because of the skills that I've been doing or because I've been working with people who need kind of care and guidance or whatever in some way. I'm going to ask you that same question again. Do you think you've got some relevant work experience now? So you just kind of have a think about the types of experience you have and whether they might be relevant to the course you want to go into. I'm going to run this poll again and just see if there's any difference between what people are thinking. Okay. So I'm launching that poll again. Pretty much the same question. Just, now do you think you've got relevant work experience? And the same options again. So yes, do you think you have? No, you don't think you do, or you're still not sure. Fabulous. So I will give a couple of few seconds for you guys to input your answers. Amazing. Right, 81% of you have voted. Just see if anyone else wants to contribute before we move on. Cool, almost at 90% again. A tiny bit longer. Thanks for getting involved, everyone. Really appreciate it. It makes webinars like this so much more interesting when we kind of hear from you. So thanks again. Okay, this is looking great. So I'm going to stop sharing the poll now. I'm going to stop, close the poll now, and then share responses. Okay, and this is really positive because essentially before 30% of you thought that you had relevant work experience, now 73% of you do, which is amazing. That's really great. 13% of you, down from 33%, don't think you have any work experience, but that's absolutely fine. Hopefully, you're attending this webinar, hopefully you're in a position where this is something that you can kind of action going forward. And at the end of the webinar and after the event, we're going to send you a couple of useful resources, some, a couple of things to start to look into potentially. And yeah, so hopefully that will kind of start you off on your journey of trying to kind of get some experiences that you can talk about in your application. Amazing. So pleased that's gone up. Lots. I'm really pleased. Lots of you feeling a bit more positive about your experiences. Fantastic. Okay, so now I'm going to hide this. Hopefully you can see my screen again now. Lovely. And I'm going to move on a bit. Okay, now I've been doing loads and loads of talking. So now I want to talk to our ambassador, Isabel. If you're able to come on screen, Isabel.
Hello.
Yeah, fab. So it'd be great to hear a little bit about, I guess, the work experience that you did before making your medicine application. But before that, actually, let's just hear a bit more about you, apart from your name.
I'll do a little introduction. So my name is Isabel. I'm a first-year graduate entry medic, and I'm therefore studying my first year here at St George's University. So my journey was probably a little bit different to the usual undergraduate route. From my A-levels, I studied medical physiology at Nottingham University, and then from there I made a second application onto graduate entry medicine, and now I'm studying that here in London. It can be really daunting, I think, first of all, when you're trying to source work experience during your A-levels, and especially during COVID. I know I started asking around lots of places, and unfortunately, because of the nature of being that certain age, people just aren't necessarily that willing to give you like shadowing doctors and things. But I think the most key thing for work experience is to just push and be really proactive. If you just try and talk to as many people as possible, send out loads of CVs, just ask, because even if you get a rejection, someone out there, someone will give you an in, someone will say yes. And like Fiona was saying earlier, it's really not about the amount of work experience that you have. I think it's definitely quality over quantity, and what you learn in your work experience rather than a tick box of, oh, I've done this, 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 and this, is much more important. So for my the work experience that I've done, so from my A levels, I did some to get into my undergraduate, and that was volunteering in a care home, in an old people's home. I also worked in a pharmacy as a counter assistant. When I was younger as well, they also had schemes, which I think they still do now, where you can shadow a doctor for a couple of days in wherever you live in the local hospital. And I think that was pretty much it for the healthcare specific work experience that I did. But alongside that, obviously, I had extracurricular activities. So I'd do dance, I'd help out in like our school musicals, and obviously I did sports clubs as well. And it's really key that all work experience that you do is still good work experience. You can always spin it to show that you've learned something that's relevant to the career that you want to pursue. So for example, volunteering in a old people's home, obviously there you develop key skills of empathy and care, and you understand that certain aspect of healthcare. So what an old people's home is like, what people's roles are there are like. And then if you are participating in a sports team, then you can show that from working in a team, like you understand skills of teamwork or leadership, or being able to commit to a club. So there are lots of different ways that you can spin whatever work experience that you had. Applying for graduate entry medicine, the work experience is not necessarily stricter, but they would prefer it to be more healthcare focused. And so during university, I was able to work part-time as a carer. And then I also worked for a year as a healthcare assistant. The best of out of all the experience I've done, I think being a healthcare assistant was the most useful, because you are there in the NHS working 12-hour shifts on a ward, with obviously very real patients, and you're working with doctors, nurses, physios. So you really get to experience what a career in the NHS will be like. And so that's one of the main things that I talked about during my medical interviews. And you can also be a healthcare assistant in your A levels. You don't have to wait until you've got a degree. I think you only need some GCSEs, and you can apply to bank and even do 0 hours. So you can just do a Sunday morning shift to kind of fit it around your A levels. The second thing that I think is most important was I was quite active in my a weightlifting society at university, and that was the thing that I talked second most about during my interviews. So it wasn't necessarily just healthcare based and talking about, working with doctors and patients and empathy and care. I could draw on my experience running a society, and those skills of leadership, teamwork, being able to problem solve were potentially just as important as having face-to-face patient contact as well. So never turn down any experience. It's just the way that you word it and the way that you talk about it. There are always like different skills that you can show that you have in your work experience.
Thanks, Isabel. And hopefully maybe Isabel, I'll get you to maybe reflect like you started doing there on your experiences later on, just to give some examples. Amazing, thanks. Cool. So having spoken a bit about, the difficulties of kind of getting hands-on clinical work experience during COVID. Now, as I say, hopefully, we're kind of moving towards things opening up a bit more. I know certainly in terms of like working in kind of clinical environments like hospitals and getting that shadowing, not sure how. I think it's really a case of investigating what's going on in your local area and your local hospital, if they're offering anything now or if they're not. I know certainly St George's Hospital, who we share a site with, are not currently offering any face-to-face experiences, and they, they're certainly not doing that. They're not doing anything up until spring, and I don't know if they will be doing face-to-face shadowing after spring. So I think it can vary quite a lot locally, depending on different procedures and policies, and what's going on in different organisations. But as Isabel said, definitely great to start inquiring, just seeing, if anything's available, going in and asking places, I think, and being proactive in your approach is definitely something that's valuable. But thinking about other things you can do at the moment if you are finding it hard to get kind of face-to-face experience, using online resources is really good, and it's a great way to gain insight into a course and career, without having to necessarily speak to people yourself. So, watching interviews with healthcare professionals and doing research on healthcare roles and what it involves, maybe different parts of the course or the job. You can certainly find that information out online on the NHS Careers website, which is just enormous and has loads of information. There's various online work experience opportunities as well. So for medicine, for example, there's a GP one run by the Royal College of General Practitioners, so Observe GP. There's also Brighton and Sussex Medical Schools work experience online platform, which you don't have to be applying to that uni to undertake. And we're going to be providing those links later. But again, it's about thinking about different ways to gain insight, which could be as old school as reading a book, by a healthcare professional, and gaining some insights into the what they do in that job, what the challenges of that job might be. Volunteering as well, so hopefully more volunteering opportunities are going to come up. Possibly during COVID, maybe you've already been able to do some volunteering. Maybe you one of those people that collected shopping for people who are isolating, or got involved in local COVID community support groups, and that type of experience can certainly be valuable. Things like looking into food banks, local opportunities, I think you can definitely do at this point. And like we've already mentioned, things that you're already doing as part of maybe school or college. So thinking about, for example, how you approached working during the pandemic, how did you cope with that, doing lots of online learning? Are you doing things like working in groups to deliver projects or presentations? Are you mentoring younger pupils, which I already mentioned? I know lots of school students do kind of things like Duke of Edinburgh or the NCS Challenge. So thinking about those types of experiences is really important as well. Okay. So just to give you some ideas, but certainly, as Isabel said, it's about kind of thinking about going forward, approaching organisations where you can get hopefully something that's, working with people in need of care and potential patients a bit more as well. So fingers crossed we'll all get to do more of that over the next few months. So moving on to think about why unis ask for work experience, and on the flip side, what you can gain from it. So I think part of work experience, why healthcare courses ask for it, it's a good way for you to gain insight into what it's like working with people in need of care. Certainly for courses and careers where you're going to be working with patients. If you're able to get experience where you're working with vulnerable people who need care, it can just help you see what that's actually really like. I think it's possible to have a rose-tinted view of what it's like working, as a doctor or in healthcare, but actually, the reality might be it's sad, it's quite depressing. You might not be able to help some people, and I think if you were able to get some experience working with people in need of care, it can give you, first-hand experience of those challenges and what it might be like, and it's something that can help you decide if working in a particular area is really for you or not, which is key when you're potentially applying for a course. It might be 3 years at university and then, a really kind of long career training pathway afterwards. So universities want people who have, gained that insight and they have an awareness of what it's like working with people in need of care, but they still want to undertake that course and career. It's a good way to show universities that you are committed to the course and career that you are interested in. If you've found work experience, you've done lots of research about it, these are the people that universities, want. These are the students that universities want. Work experience is also a great way to showcase key skills and qualities. So going back to what we talked about earlier, what Isabel was mentioning about, the skills she gained during her weightlifting society, it's all about thinking about opportunities where you have been able to develop and you can evidence key skills and qualities that you'll need for your future healthcare career. Okay. And here are some examples of them. So these are specific things that we at George's are looking for from our medical students, but actually they're really relevant across, all healthcare careers, I would say. So things like empathy, having an understanding of what all these different things mean, and what they mean in a healthcare setting, and hopefully you can talk about how you've demonstrated these or developed these skills, is kind of what you want to be doing from now on. So empathy is obviously thinking about other people, being in someone else's shoes, being able to kind of anticipate and understand where someone is coming from. Obviously that's a really, really key skill if you're working with patients, being able to put yourself in their shoes. I would always say that empathy is something that is different to sympathy, but also empathy needs to be balanced alongside I guess a sense of professional detachment and knowing where that line is, because if you're working very closely with patients who aren't going to get better, who are very ill, who are going to die, then for your own, I guess, sense of self-preservation, I would say it's important to be able to have that sense of professional detachment of yourself from work, and kind of make sure that while you have empathy, it's not something where you're getting too close or it's affecting you too much. Okay, so I just always like to mention professional kind of detachment alongside empathy. I'm really hoping you can see how things like communication skills and organisation, problem solving and teamwork are relevant to healthcare. So particularly if you're working with patients, you might be working with lots of different types of patients, older people, young kids, people who don't understand English. If you think about explaining certain procedures or giving instructions to someone, you might have to think, well, actually, how am I going to explain this in a way that they're going to understand, that's not just using lots of kind of scientific or medical terminology. So thinking about your communication being flexible and adaptable, for example. Being able to take the initiative, being able to make decisions quickly, be a leader potentially, might be important in some roles. And being resilient as well. So thinking about, well, actually, if I'm working with a patient and they are not responding to treatment, or if they, they don't want to, go by their treatment plan, what do I do then? Is there another pathway I can take? Or it might even just be thinking about your own, resilience. Working in some patient-focused healthcare roles can be really challenging, stressful. If you're working in the NHS, you could be working really long hours. It could be really draining. So thinking about how, you will cope with that. What's your own personal sense of resilience like, and how will you kind of manage that stress when you're on the course and career? So thinking about those type of things. Insight and integrity. So insight could be around, I guess, having a deeper, it's really about having a deeper understanding into something. So that could be, the reasons why patients might be doing what they're doing, or why people are doing what they're doing, which I guess would be linked with empathy. But it could also be around, having a sense of insight into yourself, into, the way that you are, into your coping mechanisms, into things that you find difficult, knowing things that you need to work on in the future. And actually reflection, which we're going to talk about in a minute, is a great way to kind of gain that insight, I think. So like I say, I think in terms of these key skills and qualities, and there's absolutely loads more, and certainly if you are looking at particular courses at particular unis, often they will have on their entry requirements website, or if they're talking about interviews, they'll talk about, the particular things that they want to see in their healthcare students. So some of them might be these type of key skills, some might be others, but there's absolutely lots out there. So it's really about thinking, do I have these skills? How can I evidence that I have them, and how can I show that to the universities? So that's really what you need to be thinking about from now on. Okay. Just want to mention NHS values as well. So certainly if you're going for a kind of job in the NHS, you'll want to have an awareness of these, certainly if you get to an interview. And just think about, I think, again, with the key skills and qualities, about thinking what these values mean, what they would look like in practice in the NHS, and thinking about, can you illustrate that you share these values and qualities? Can you demonstrate through experiences that you have that you, for example, have a commitment to the quality of care? Okay, so similar type of thinking. Okay, and now we're going to move on to thinking about reflection, what that is. And I mentioned earlier that essentially reflection is like a massive part of work experience. So what I would say is that when universities ask for applicants to have work experience, if, for example, you are asked about your experiences at interview stage, universities don't just want a list of things that you've done reeled off, because it's not just about like chalking up the experiences. What universities want to hear about, as Isabel alluded to earlier, is what you've learned from those experiences. So it's about asking yourself kind of key reflective questions to really draw out from your experiences, what you've learned from them, what you've gained from them. And it's by doing that that you can kind of evidence things that you've learned, or key skills that you've gained, or knowledge that you might have gained. Okay. So some good questions to ask yourself initially to kind of reflect on any experiences that you've had might be what, so what, now what. And that kind of stands for, what experience do you have? So I guess that's like the initial kind of listing, the details, what, where, when, the basics of your experience, which again, it's important to, have, and actually have, keeping a record of these things is really important. Universities might still want to know that detail, but it's just not the most important thing for them. And then thinking, so what? What did you gain from this particular experience? So thinking about the things that you did, key scenarios that might stand out to you, and kind of verbalizing them, writing them down. And now, what do you know about yourself that you didn't know before? So again, that's thinking about, have you learned through a particular experience that you really didn't enjoy doing it for this reason, or that you didn't like working with those people? Did you realize potentially that you need to work on some key skills in the future? Okay. And I would say that if you're reflecting on certain experiences, it's not a bad thing to have to realize that actually, oh, I wasn't good at that, or I need to work better at that, or I don't want to do that, because these are all things you've learnt, and that's valuable in itself. And I would also say at this point, actually, that if you're talking about experiences that you've had and the impact that they had on you at interview, for example, it's not a bad thing to mention, like more negative stuff, like, I realized I wasn't good at this, or I realized I need to work on this in the future. The key thing would be to kind of talk about what you're doing to change that. But it's certainly not a bad thing to I guess make yourself vulnerable, and to show that you have things that you need to work on in the future at interview, because universities don't want people who think they're perfect, who doesn't they've only got who think they've got nothing to work on, because they're not going to make a good healthcare professional. Okay. So it could be, like I say, it could be lots of different things that you've learned, that you learn about yourself through doing this reflection. So we're going to just look at an example of this, and then actually I might ask as well to kind of maybe reflect on some of her work experiences. So we're just going to look at this example of someone who's got a cafe job. Okay. So they've been working in a cafe, they've been doing it for a few hours every weekend. Again, like I say, it's a good idea to kind of keep records of these type of things, and actually doing these reflection exercises is really important to do at the time you're doing them, or if it's quite a kind of short experience, to do it soon after, because if you wait until later on, until you're applying for unis and courses, chances are you'll have forgotten all that detail. So it's really important to kind of write stuff down at the time when you remember it still, and then you're just making life so much easier for yourself later on. So they had this particular cafe experience. What did they gain from it? So they realized how important time management is during busy service. They've learned a range of food preparation skills. So they've learned knowledge, but they've also kind of gained some skills there. They've also learned how to work as part of a team as well, which is really important. So I would say if someone was verbalizing this and talking about this for work experience, that's they can link that to their experience to teamwork. It might be good to go into a bit more detail and give a particular scenario example, because it's really good just to give a bit more evidence and specific examples, for example, at interview stage. So what do they know about themselves that they didn't know before? So when they learned how to ask for help and make decisions quickly during a particular event, this Christmas event they had to do, and that was hard for them at first. Excuse me. But they kind of learned to do that, which is really positive. They've learned that they're confident working in a busy environment now, and that they can ask for help when required. And they've actually made that link to healthcare. So in healthcare, they'll need to work as part of a team. So it's all about bringing it back to the particular scenario, the healthcare area that you want to go into. this person's learnt that they need to work on how they speak to angry customers and not let their frustration show. Again, hopefully you can make the link with how that might be relevant in healthcare. You might have to deal with angry people sometimes, and honing your techniques there would definitely be valuable. And they've also learned how to share their ideas and listen to others. And again, really important when working alongside others in healthcare. Okay. So as I say, I'm really hoping that's given you an idea of how you can ask yourself reflective questions about experiences and how they can become relevant to healthcare careers that you want to go into. We've got a little bit of time, so I think I will just ask Isabel if she's all right to come on and maybe just talk reflectively, maybe just have a bit of a reflection on some of her own pre-university work experiences, if that's all right, Isabel.
Yeah, that's fine. What I would say is reflection, I think at first, if you've never done it before, it does feel very unnatural. So don't worry if you kind of struggle to do it like from the first time, because it is just really hard talking about yourself. As funny as that sounds, it's very difficult to try and talk about yourself in a way that presents you well to whoever's interviewing you. So don't worry if it's difficult at first, but it's something that you're going to be doing throughout your whole career. So it's really good to start now. And obviously it's something that you're going to have to do for the interview anyway. So what I found really helpful when talking about my work experience is obviously try and cut it down to the most significant ones. So obviously, like Fiona said, don't just list it. They don't care how much you do, it's obviously what you gain from it. So say that you did, I don't know, 5 different work experience things, maybe pick the top 3. And then within that top 3, hone into a specific circumstance that you came across. So for example, for me working as a healthcare assistant, I came across like lots of difficult patients. So I could pick one patient who potentially was unhappy with something, like maybe unhappy with care, or an accident had happened that day. I don't know, they fell over and cracked their head open. And then you can talk about that one experience in a lot of detail, and you'll be surprised about how many skills will come out of that. So for example, if I'm going off of working as a healthcare assistant, there was a time when I walked into a patient's room and they had fallen over on the floor and cracked their skull open. In this moment, obviously, you can talk about how you dealt with nerves and being in a pressurizing situation, be able to cope with, following NHS guidelines of dealing with an accident of this nature. You can talk about your empathy and your communication skills of talking to that patient, making sure that they remain calm, and then, making sure that they're, as best as you can, they're okay. You can talk about teamwork skills. So pressing the help button meant that nurses and doctors would come to the room, and then you can talk about how you explain to them what happened, what you think went wrong, what you think needs. Obviously, they would take over from you at that point. But in that small example, you've picked off teamwork, pressure, empathy. So, and that's only using one very specific moment. So this is what I was saying, when you don't need tons and tons of work experience. It is very much what you gain from just like a small amount of experience. Another tip I would say is you can kind of structure it into healthcare related work experience and extracurricular work experience. So obviously I've talked already about healthcare related work experience, and that's very much what your understanding of the role that you're going into. So what makes you a good candidate for example, a role of a doctor or a nurse? Like, what skills do you think you need to be able to go into that career? And obviously the best way to experience that is to be able to get some experience, if you can, working in healthcare, working with patients. With extracurricular activities and things like part-time jobs, I think it's a lot easier to talk about skills you have in those scenarios. So if you, like I gave the example earlier with my powerlifting society, being president of that society meant that I had to have very good time management, because I was juggling university work plus a part-time job, and obviously running a society. You can talk about conflict is another interview question that people absolutely love. So in a society, not everyone's going to agree with the way that you run things, or they're not going to agree with I don't know, if you're doing like you're running a session, they might not like the way you're running with it, so you can talk about ways you overcame this. And again, this is talking about resilience, commitment, time management in just one very small scenario. And even though it's nothing to do with healthcare, you can then link it back to whatever career that you want to go into. So for time management, that's going to be a key skill that you need in pretty much any role in healthcare, like whether it's a nurse, doctor, physio, you're going to need time management. You're going to need both leadership and teamwork skills and communication skills. So it's very much not just saying the key words, linking it to something that you have actively done. So you're showing the interviewers your understanding of how you showed that particular skill. So yeah, I think, and then obviously previously Fiona did say journal. That's number one. Just whatever work experience you do, write it down there and then, like date, time, who you worked with, because when it comes to collating it all for your personal statement or for interview, it will be so much easier to look back on when, because you have to put in the kind of the dates and times that you do it anyway. So you might as well just do it there and then. And then you can write down something interesting that might have happened that day. And then after you've got all your experience, you can find the key skills that they're looking for. So obviously like integrity and insight, communication, and then you can kind of formulate a structure of, okay, if they ask me a question on communication, I have this particular circumstance that I can talk about, or if they ask me a question on a situation where I failed, I can talk about a certain situation and how I overcame that. And part of the difficulty of interview is being able to quickly think about these experiences and to talk about them straight away. And it is unnatural at the beginning. So if you have them like written down, you know exactly what they are, it'll make your life so much easier when it comes to interview, of just being able to talk about them like fluidly without having to think too much. So yeah, write everything down. Try and structure it into healthcare and extracurricular activities, and link it back to a key skill and pick out like one specific circumstance. They're all tips that help me, so hopefully they'll help you too.
Fab, thank you, Isabel. That really links into, I guess, what we have on this slide as well. So it is about making those links, and like Isabel said, we're just like complimenting each other massive. But I think certainly one thing is I interview for our medicine course at St George's, and one of my bugbears is when candidates will know, and again, this, I don't think this is particularly, just applies to people who want to do medicine, but if people are talking about, they know what the keywords are, so they know that empathy is important, but they might just say something like, oh, well, I worked in a care home, so I really, was able to demonstrate my empathy, or I saw empathy, and then they move on. And as an interview, it doesn't give you still don't know whether that person actually has an understanding of what empathy means. And you also, they haven't given a specific example. So like Isabel said, it's really important to give that sense that you understand, what these things mean, what they actually mean in healthcare. And then, like she said as well, given that scenario, a particular example is good as well if you can. The more specific, the better, because, as this slide shows, it's all about journaling, having an interview question, having an example or evidence to give, and then it's about linking things back to the profession as well. So, for example, if you are talking about, you're asked a question like, what key skills can you bring? What skills do you have that will be useful for this job? You might want to talk about those skills, give examples, and then link it back to healthcare. So particularly if it's something, where you're working in a shop where it's not in a healthcare environment, talking about and saying to the interviewer, this is why, the experience I've talked about is relevant to healthcare because da-da-da. Just making all those links, making it as easier for the university to kind of, get that as possible, I would say. Okay. So I think we've probably already talked about this quite a lot, in terms of kind of how to make the most of experience and kind of self-reflecting. I don't know if there's anything else you want to add, Isabel, at all. I know that I'm pretty sure that in medicine anyway, kind of reflecting is kind of what you do as part of the course, I think, isn't it, in terms of thinking about placements and writing reflective pieces on placement. Is that right?
Yeah, this is the thing. You've obviously got reflection on like on patients, on healthcare, and obviously skills that will help you in your career. but a lot of it is also you're forced to have self-reflection like consistently as soon as you start medicine, because it's a completely different environment, and it is a lot of work. You have to structure your days differently. You don't get as much support as you would do in A levels in school. So from the get-go, you are forced to kind of look at yourself, look at what you're doing right, look at what you're doing wrong, because you will make mistakes all the way through. And even just being a good student and getting through medical school, you're going to be forced to have to look at things that you are struggling with and how you can overcome them. So it's, yeah, with work experience, it's just so not a tick box. It's something that you are just gonna, it's whether you are right for the course as much as if the course is right for you. And as soon as you get into, like, you know, the university course that you're studying, although you might not be working with patients from the get-go, you will be forced to reflect on yourself. And even if it's just like studying techniques, revision techniques, or just getting on with independence, like living alone, it's something that you have to do consistently, and it really does benefit you. It's not just some annoying task that, you know, teachers or lecturers like to set you as an assignment. It really is to like push you as a person, to better yourself as a person, not just academically, but also personally as well. So in very much just your overall life as well as your academics. So it's really useful. So just take your time with it and don't kind of just, you know, write any old thing, like, it's just, you're going to have to do it in the future as well. So get used to it now.
Great, thanks, Isabel. Cool. So I think we're almost done the webinar, but we do have some time for questions. So I'm aware, I can see that lots of you have kind of had questions around what counts as work experience. And like I said at the beginning, I think it's very much about, firstly, if you have an idea of what unis and courses that you want to apply to, have a look on their websites, because if universities and courses have requirements around, you know, work experience, you know, they're within their rights to say, you know, this counts, this doesn't count. So your first port of call should really be with the university you're applying to, because different unis will say different things. Some might say you need to have a certain number of hours in a particular place, and others won't. So it's that annoying thing where you do, unfortunately, have to just do lots of kind of research. And I'd say look on university websites, look on, you know, healthcare course entry requirements pages, because if there are requirements around work experience, they should be listed there. Okay, so it's about doing that research. But I would say certainly some universities will have the view that actually, you know, like George's, we don't say this counts and this doesn't count. We don't have that kind of those hard and fast rules. You know, we want, as our statement at the beginning, you know, illustrated, we want students who have an awareness of, you know, have an insight into the course they want to do, and they can showcase the relevant skills and qualities. Now, the skills and qualities that we're looking for will probably be listed on our website. So that it's therefore down to the candidate to think about, you know, what have I done? I'll reflect on it, and can I draw out those key skills and qualities? So I would say it's not that helpful to think of it as, does this count? Does this count? Because someone could do some, like a week shadowing in a hospital, but if they can't tell us what they've learned from it, and, you know, they didn't seem to learn anything from it, then it's not going to count for anything. Because like I say, universities want to know what you've learned from it. That's what they're going to be assessing. They're not just going to give you a tick, you've passed, because you've actually, you know, spent 5 weeks on a ward or whatever. Okay, so I know it's hard, and I know it's confusing, because actually, you know, different unis ask for different things, but just try to get out the mindset of, you know, does this count? Does this count? Because it'll count, and it will be relevant and useful if you can make it relevant and useful after having, you know, reflected on it. If that makes sense. So I think we've also had some questions around, you know, how do I find shadowing work experience opportunities, and, you know, how can I try and find people to talk to? I'll maybe ask Isabel about this in a second, but I think it's good to kind of look locally, to start locally at the beginning, and just contacting people that you can. So maybe it might be contacting your GP surgery to say, hey, look, is it possible to do shadowing here? Send an email. You know, I'd say send off, like Isabel said, send lots of emails off and get in touch with as many people as you can to say, you know, is there anything you can offer me? Are you doing face-to-face? If not, can I just have a phone chat with a doctor or something like that? But as I mentioned earlier, different places are doing different things. So it is just a case of you guys being proactive and seeking them out. It might be even about, you know, going on hospital websites, emailing them. you know, sometimes doctors and other consultants have their email addresses, you know, there for anyone to see. If they do, if those details in the public domain, maybe email them and say, hi, look, you know, I'm interested in shadowing. Would you be able to do that? You never know. So the only thing, it's worth doing because, you know, you might get a yes out of it. If that makes sense. I don't know if you've got any other kind of guidance there, Isabel, around kind of how to actually find shadowing opportunities and things.
Yeah, pretty much just what you said. Just you have to be really proactive. Just the thing about the emails is actually a really good hack, because you can always find the doctor's emails that work in hospitals. It will be on the NHS website. And sometimes when you email them directly, because when you email the not customer services, but like a specific email address for work shadowing, they have so many that you're probably less likely to be contacted back. So if you go directly to, even if you don't know who the doctor is, just email them. They are usually really nice and really helpful. With GP surgeries, I don't know if a lot of them are going back to face-to-face patient seeing anymore. So I don't know how helpful it will be to actually sit in a GP, because I'm on placement at the moment and still a lot of it is via telephone interviews. But what I would say is, if you ring up your local GP and just ask to talk to them for 10 minutes, I'm sure they'll be more than happy to just chat to you. And obviously prepare some questions beforehand of what exactly you want to ask them, like, what is it like being a doctor in primary practice? What was it like when you were in medical school? Like, what do you find difficult about being a doctor and not? And sometimes you can even get more out of that from having a one-to-one conversation with the GP than you could from shadowing a doctor for a whole week. Because sometimes it's just kind of like sensory overload. There's so many things coming in that it's difficult to like pinpoint, like I was talking about earlier, the exact thing that will allow you to talk about, like, you know, skills that you need. So really utilize just phoning up people, emailing people. I actually think YouTube is a really good resource. Like, I'm sure probably like 80% of you like follow some medic or nurse or physio on YouTube, and they obviously document their whole life. I know it's a bit strange because it doesn't maybe come across as overly not professional, but it's not the same work experience as talking to a doctor, but they're still showcasing their whole life and their lifestyle. And again, it's the way you phrase it. So if you pinpoint things that, you know, happen to them, and you can say like, oh, I know what it's like to be a medical student because I follow this person and these were the troubles they had along the way, and this is how I would deal with it. Like, it's still all relevant. Yeah, I think there might be also some examples where you've looked after family members. So during COVID, it could literally be as simple as going giving shopping to your grandparents, or dropping off resources to your next door neighbour. You can always use them as like an example of when you cared for someone. And also, I would say, don't underestimate just talking to medical students, because a lot of people, obviously, you want to shadow doctors. That's kind of what everyone thinks is the A-star work experience, because that's the career that you want to do. But you won't be a doctor for, you know, 5-6 years. So talking to medical students or students actually studying, it can be really beneficial, because then it lets you know what you're going to be kind of looking at in the next year or so. So what is the workload like? What are the hardships they found? Was being a student what they expected, or were there any challenges? And I think that kind of presents a different light to it. It could make you stand out as a candidate, because you're not necessarily just going after what everyone wants. You're looking at your near future, and you're taking into account like your role as a student before you get to, you know, graduating as a doctor or a nurse, or so on. So yeah, just use any resource you can. Email anyone. Like, I know a lot of my friends, like, they're happy emailing people like questions to like interviews or like work experience. Most people are really genuinely happy to help, because obviously we all went through it too. These struggles we've all gone through. So yeah, just don't hesitate to ask.
Thanks, Isabel. I've had a couple of questions through about do you have to be a certain age to shadow someone in a hospital or GP centre? I know at St George's Hospital, obviously they're not doing face-to-face work experience at the moment, but people had to be 16, but had to be 18 to work in certain areas. And I would say there might be a standard, but I would really check, because the same thing, it might be the case with care homes. I know previously Some care homes ask people to have DBS checks, which can take quite a while to come through. So I'd say it's worth checking out with the particular hospital or GP surgery you want to go into. And just a couple of other really quick tips before we finish, as well as that kind of being proactive and contacting people, making sure you're professional, be as available as you can. So make sure you phrase your emails professionally. Don't just use punctuation, grammar. Let people know when you're free, but also kind of be as free as you can be. Okay. We are going to have to stop it there. If you have asked a question and we haven't managed to answer it, we will be getting in touch with you after the event with an answer. So, feel kind of pleased that you will get a response to your question essentially within 5 working days of this event. So sorry if we haven't been able to answer them all. We do want to finish up on time though, and again, no need to note this down. We'll send this out after. Here are some online resources to get your research started. So virtual work experience links there, ways to just find out a bit more about the NHS, and the NHS careers website has a page on getting work experience, just some useful links there. But again, we'll email this out to you after the event, so don't worry about catching those details now. Really quickly, just a few points. If you do have any queries for us, you can get in touch with St George's via all these options here. A survey will pop up after the webinar has closed, so please do just answer that survey. Let us know how you found the session. Was it good or not? Just let us know. It's really helpful for us in the future. And yeah, that about wraps it up. And we really hope this has been useful to you and has kind of helped you in going forward. And like I said, we will be able to reply to those questions shortly. Okay, so all the best. Have a really good evening, and yeah, goodbye from myself and Isabel. Bye, everyone.